Well, it happens to be Dental Health Week, so Dr. Emma has some tips for us on how to properly look after our teeth.
Hi, I'm Dr. Emma. Preventative dental care is so important. A lot of the procedures that are carried out in the dental chair can actually be avoided if you've got really good prevention in place. So that's why it's so important to visit your dentist regularly, have good preventative care so that you can avoid a lot of hassles in the future. A big part of prevention is making sure that you remove the plaque and calculus that's in your mouth. So what's plaque? Dentists love to go on and on about plaque and calculus. Plaque is the bacterial colonies that live in your mouth. It's the white gooey stuff that comes off when you brush your teeth. Calculus, or people love to call it tartar as well, is when the plaque gets hard and it can no longer be removed at home by yourself. The main place that calculus tends to build up is behind the lower front teeth, down there. And that's because the saliva pools in that area and minerals that calcify the plaque come from your saliva. This is the main spot that gets cleaned when you get a scale and clean at your dentist. So that's why it's really important to visit your dentist for a regular scale and clean to have that calculus removed. The research shows us that it actually takes about 48 hours before plaque will reform on your teeth. But not everyone brushes so well they can afford to do it once every 2 days. That's why we recommend brushing morning and night to keep your plaque levels down. Electric toothbrushes are fantastic. They make the job so much easier and quicker. The correct technique for brushing with a manual toothbrush is to angle towards the gum line and use gentle little circles the whole way around. And it usually takes about 3 or 4 minutes to do a proper job. An electric takes all the hard work out of it for you. You just have to hold it there, move it around tooth to tooth, and it only takes about 2 minutes. So quick and easy, and that's why I love them. Toothpaste is basically a delivery mechanism for fluoride. So when you think about it like that, rinsing out with water after you've brushed doesn't make a whole lot of sense. You're rinsing all the fluoride off of your teeth when you really want to leave it on there for the most benefit. So what I recommend is after you've brushed, spit out the excess paste and leave the remainder sitting on your teeth. Flossing. People seem to see it as some kind of optional extra for the dental nerds who really love to get their teeth clean, but it's so important to do it once a day. Imagine taking a shower but not washing underneath your arms. That's kind of what you're doing to your mouth when you brush but you don't floss. You can do it any time of day, whenever it suits you in your routine, as long as it gets done. Getting daily fluoride exposure onto your teeth is really important. Fluoride basically makes your teeth more acid resistant, so it protects against decay and also helps to protect against the daily onslaught of acidic things we put into our mouths like soft drink and citrus fruit. So getting that daily fluoride on there really helps to protect against acid. People often ask me how frequently they should be visiting their dentist, and it's a bit of a case of how long's a piece of string. It's going to depend on how well you clean your teeth at home and how much calculus your mouth builds up. This is where your HIF extras cover can come in. It's going to substantially reduce the cost of your regular dental visits, and if you've got good preventative care in place, help reduce the need for costly treatment in the future. I've been practicing as a dentist for 10 years now, and something I've seen again and again is that patients who get the best treatment are the ones who are really involved in making decisions about it. That's why I think it's really important that you have a health insurer who lets you choose your own dentist.